Welcome to A Window on SAHMRI, where we take you inside South Australia's independent not-for-profit health and medical research institute. Each episode, we get to know the people driving our life-changing research, getting into what motivates them personally and how their work is delivering a brighter, healthier future for all. Ryan, what were you interested in as a kid?
As a kid, I was a very avid sports player. I think I played almost every sport. Doesn't mean I was good at them all. At one stage, I wanted to be a professional soccer player, then ruined both my knees. And then I wanted to be a professional golfer, then broke my ankle. Then I gave up on sport.
Okay, it's a bit of bad luck there.
Yeah, a bit of bad luck. So sort of growing up was just like a scientist was always the broad dream.
Any other hobbies outside of that? Or were you always at training or at a match?
No, always at training and at a match. Yeah.
So what did that do to your identity then when you kept getting those injuries and you weren't able to play?
It was pretty brutal. So I had a double knee reconstruction at the age of 12 and I was pretty competitive in soccer. I was playing in the state team and all of that in WA. Moving into high school and then losing your identity as, I'm going to be a professional sports player was pretty big. So
did that injury mean you pretty much had to give up that dream?
Yeah. Yeah, I had to give up soccer, like competitive soccer altogether. I was out for a couple of years and then obviously puberty hits and then everyone's twice the size of you and all that jazz. So so I kept playing golf, still play golf now, but yeah, the focus after that was sort of becoming a scientist, if you will.
Yeah, what did that do to your confidence as a kid?
It was quite strange. Being in a school where there was a lot of competitive sport players as well, and you're a part of that group and then you're sort of removed from that group purely because you can't be competitive in that area and keep up to speed with everyone else. There's the other side of things as well, where people, the academic friends as well, who really wanted to aspire to be scientists or doctors or anything like that. So, I kept with that group of friends. And
so were you always interested in science even when you were focusing on sport?
Yeah. Science and maths. I was quite good at maths in like moving through primary school, but didn't really want to be a mathematician. And then, science is sexy. So yeah, that's what they
rolls
say.
Off the tongue.
Yeah, it is. Yeah.
Who sold you on that?
Well, I don't know.
Some science teacher.
Some science
this
teacher.
Is how we're going to get him in.
Yeah, exactly. Science is sexy. And then you're on the other side of things like, I think they were lying. Yeah.
Did you have researchers in your family?
My granny or my grandma, she's got a PhD in education. So she's done a bit of research in the education field. And my mum's currently doing her PhD as well. So she's now doing research in education as well. In terms of science, I'm the first scientist in the family, yes. So
where did that interest in science come from?
I think it's just one of those things that I was just good at it. Like, from an academic standpoint, I was pretty good at science. Like I found it quite easy to understand, but I was really, really interested in it as well. So human biology for me was my biggest interest. Arguably, I was better at plant biology, which doesn't quite make sense, but I didn't want to be a plant biologist or a botanist. So I stuck in with human biology and sort of ended up in the sort of medical field.
What was it about it that really fascinated you and sort of captured your imagination?
With my field being about the brain and the spinal cord or the nervous system, the biggest thing was the more we learnt, the more we understood we didn't actually know. And I kind of felt with all the other organs, they sort of had it all sorted out and they knew how it all worked and all of that. But then the brain and the spine, they just had absolutely no idea. And
so I was mystery.
I was one of those maybe a little bit cocky, but I was like, I'll work it out. Yeah. I'll work out how the brain works.
You'll solve the riddle.
Yeah, I'll solve the riddle. Yeah.
Well, I guess it is a bit of a new frontier still in that there's so much we don't understand about it. It's a bit like the ocean.
Exactly. Yeah. Very undiscovered.
How did that interest progress?
Yeah, so I suppose in high school had a big interest in human biology. Realistically, in high school, I didn't know what a scientist was. I don't think a lot of people really understand what science is like until you
just knew they were sexy.
Yeah. You just automatically sexy if you're a scientist, right? So that was number one goal. But I remember in university, a lecturer gave a presentation on stroke therapy. And this particular lecturer worked on a study where someone who's had a stroke and the one side of the body's paralyzed, a way that you can trick the brain is you put their arm that's working in a mirror box, which makes it look like their left hand's sitting on the other side. And they get them to do a whole bunch of exercises with the right hand to make it look like the left hand's working. And over time, these people who had a stroke could regain function in their left hand. And I was like, that was just unreal. That was so cool. So I was like, I want to work in that sort of area, brain therapy or spinal cord therapy, rehabilitation.
Did you have a personal connection to anyone who'd had an injury like that?
No, that was sort of reflecting back. I arguably didn't know anyone with a stroke or spinal cord injury up until basically when I started at SAHMRI 5 years ago. That was probably the first time I really met these people and interacted with these people. Yeah.
But seeing that at uni, it sort of looked like magic.
Oh, absolutely. And it was, it was kind of like magic. So people didn't really know how it was working. They just knew it was working. So, and then that's how they were beginning to understand the biology of how you can trick the brain or treat the brain.
So what really grips you when it comes to looking for treatments for spinal cord injury?
I think this has sort of changed a lot over the years. So for me, it was, arguably first getting into this field of research was I want to be the person that finds the cure. I want to be the person that gets the people walking again. Like I want to be the famous person, win the Nobel Prize for spinal cord injury, which doesn't exist, but it would if if I got it. But it was more as I began to interact with patients, sort of seeing what they're going through. For me, that sort of gripped me into wanting to help them. Just was hearing their stories, how each person is completely different.
Is there anything that's touched you in particular?
I mean, most recently, a really big thing for me was we had a participant, 18-year-old at the time, went to sleep and woke up completely paralyzed. No accident, no sport injury or anything like that. Just completely fine the day before, not so fine the next day.
Right.
And over time, I've gotten to know this participant. I've met some of his family members, and just it put a big shift on understanding the impact of spinal cord injury on a person, on their families, but also learning the flaws in the system, either from like a hospital standpoint and a research standpoint, but also the support of the patients as well. So I'm starting to work towards a new, whether it be the sort of personal endeavor or eventually we get it into like some sort of a research program, but as how we can help these patients from the injury and getting them the help that they need. So whether that's insurance schemes, the correct types of rehabilitative treatment, letting them understand, what's out there in terms of how they change their house. So what taps can they use? What chairs are good? All that kind of stuff, because that's not really well described to these patients and they have to find out by themselves. And I think that's not good enough. It's they're already so isolated with their injuries, and then all of a sudden there's just zero help for them. They're just going from hospital to rehabilitation. Then when they go out to the real world,
and
it's
having to work it out for themselves. So
yeah.
It's about having that comprehensive view of things where you're not just looking at the injury and the reality in hospital, but actually everything around their life to make that more doable.
These patients are living normal lives to their 70s, 80s, 90s. So that's a long time to be left alone in the real world, trying to learn the ins and outs of their injury and how they can move on with it.
Was there an explanation for why that person woke up paralyzed?
So they believe it's what's called transverse myelitis, which is just basically inflammation of the spine. I think to date, they don't really know how that inflammation came about. It's a type of spinal cord injury, extremely rare, but it does happen. And the fact that this individual was a healthy male, 18, and then all of a sudden he's become extremely unwell, that's a mystery in itself. And, there is people out there researching this kind of stuff, but, it's a very difficult area to research.
How personally attached do you find yourself getting to these kinds of cases?
We're always told that you have to be very, very, like from an ethical standpoint, you have to be very careful that we don't become attached to patients or participants or anything like that. I'm an emotional person, and, I think I interact with people on an emotional level. So it's very easy for me to get attached on emotional, empathy is a big thing. But I also have to be very careful that, you're not giving these people false hope. So I'm not going to tell them, I'm going to cure spinal cord injury, you'll be fine in 10 years' time, because that's completely inappropriate. But for me, one of the things I've made very sure of is that because they are a small community in the grand scheme of things, is helping them. So I've been asked by individuals to send them emails of any clinical trials that I'm aware of. I'm very lucky that I know what clinical trials are going on because it's sort of my area of expertise. And they're not my clinical trials, but I can just pass on a website or a flyer that someone may have and send it off. And if they want to be a part of it or look into it, they can. But that just highlights the lack of resources that they have on their end, where they're not being told about how they could get these resources or gain this information or be a part of these studies. They're sort of relying on people like me, which there's not a lot of, that gives them that information.
Seems obvious that you feel quite a personal connection to that work. How much are you inspired by being able to conjure up that image of an actual person who is suffering from what you're researching every day because you've actually met these people? How does that then impact the way that you work and I suppose your capacity to keep working when you want to give up or when you're getting frustrated?
Yeah, I think, clinicians have a lot of interaction with these patients. So, clinical researchers have firsthand experience of, maybe in the acute setting or the rehabilitation setting of what these patients go through. But I think as a basic scientist, and this is any field of research, there's a lot of scientists that, don't interact with their consumers, if you will, like the patients that their treatment will hopefully cure. So for me, I try and design my research, or at least inspire research that will have a direct impact on, the participants that I've interacted with.
Do you have them in mind when you're working?
Oh, absolutely. Because I often ask them questions. So when we're having participant interviews, a lot of the time it's over coffee and I just ask a few questions, but a lot of the time they'll tell you their story and all the stuff that they've gone through and how they're impacted. And, that really for me drives my research. Like, okay, this particular person, they have extreme pain, whereas another individual has no pain, but maybe they have depression or some form of like PTSD because of their injury. So for me, it's like, okay, I know that if I do research in this particular area, I know directly I could impact that individual. And I think that's helps drive my research in a very specific way.
That would add another dimension to it for sure.
Yep.
Tell us about your relationship with Neil Sachse.
Yeah, so I, admittedly didn't know much about Neil before I joined the Neil Sachse Centre. So I joined the Neil Sachse Centre 5 years after I finished my PhD. At the time, the Neil Sachse Foundation was a foundation. And then Neil and I worked together to implement it into SAHMRI. So it became a part of SAHMRI. And at first, Neil, he was a footy player, So he's not the scientists and the researchers and the academics that I was used to interacting with. But also that just made everything so much easier because he didn't really care about the nitty-gritties of research. He was just wanted to know how we could get things done in fast and efficient manner and move on to the next thing. Neil and I very, very quickly became very good friends, and he became a really big mentor for me up until the point where he obviously passed away. And yeah, I had a very, very good relationship with Neil. He put a lot of things into perspective, in the spinal cord injury areas that I was looking at, but also just in general life endeavours. And
for everyone's reference, a footy player who suffered a spinal cord injury during a match.
Yeah. In 76, I think it was, yeah. I think he was the first spinal cord injury on the field that's sort of been documented, and it was televised as well. So the reason why spinal boards are now put out when there's a head-on collision, that's really because of Neil's accident.
What was his vision?
Neil's main vision was he didn't want people to go through what he went through, which was, how he was diagnosed, how his spinal cord injury was diagnosed, sitting in a hospital bed or sitting in his wheelchair, being poked and prodded. Can you feel this? Can you move this? No. It's very invasive, and it's not nice for the patient. Like they've already gone through a very traumatic experience, and then you're just doing something
feels
like
a bit dehumanizing.
Yeah, exactly right. And for Neil, spinal cord injury education was a huge thing. So prevention was one thing. So he created a number of videos for young students or like primary school students to teach them about the dangers of spinal cord injury, risky behaviours, jumping from roofs into pools, diving into pools or whatever, but also what to do in an event of if you suspect a spinal cord injury has happened. So going around to schools and explaining these types of scenarios to students in a educational and fun manner. On that note as well, from the diagnosis side of things, his big vision was Project Discovery, which was developing a way that we can actually better diagnose patients when they have a spinal cord injury, which can either lead to better treatments, better rehabilitation, or just a better understanding of whether someone could or would get better over time.
And there's a big bike ride connected to Project Discovery. Just tell us a bit about that.
So we're up to number 7 now. I've been a part of this would be my 5th one, I think, or my 4th one. So Project Discovery was basically started by Neil and a number of footy players to raise money for spinal cord injury research. So obviously Neil has a huge footy fan base, and a lot of footy players are bike riders. So it originally started with these riders getting together, getting around Neil, raising funds for spinal cord injury research. And now this is our 7th year. We don't have all the same footy players that were riding in the first one, but we do have some OGs, if you will, or alumni. And now we have bike riders and people who may not be aware of spinal cord injury research, but they love raising funds for research. So they get around and And
it's a pretty serious ride as well.
Yeah, it is. So it's 3 days. Arguably this ride this year is probably a more easy one, but yeah, 3 days, sun, rain, hail, lightning, doesn't matter. You're riding.
Through what area?
Through Adelaide. So we've done Kangaroo Island. So we've ridden to Kangaroo Island, around Kangaroo Island and back. This year's ride is to Clare and Wallaroo, I believe, around those areas, and then riding back to Adelaide. So every day is about 100 plus kilometres, and there's a fair bit of elevation in those days as well, just for a bit of torture.
And how much has been raised about overall?
Yep. So I don't know the exact number or the decimals off the top of my head, but yeah, we're over, I think, nearing $500,000 just purely from this ride alone. Yeah.
Wow. And what's special about it for you personally?
For me, I think just the camaraderie that I've witnessed being part of these rides. So I remember I did it in the 2nd year of joining up at SAHMRI. I'd never ridden 100 kilometres before, which was a very stupid move. The support that I was given just as a rider, ignoring sort of what we were there for, was incredible. No one knew who I was. A lot of people didn't even know I was the researcher at the Neil Sachse Centre, but everyone was just getting around one another. It's a no-drop ride. No one gets left behind, and everyone just has fun. That's the biggest thing. But what amazes me is just how easy people can get together and just raise funds for research. So we're obviously raising funds for spinal cord injury, but these people, a lot of them don't know someone with spinal cord injury, but they know Neil. They know of Neil. They know Neil's story, whether through direct friendship or just hearing his general story, and they're just about raising funds. That's it.
Is Neil why you signed up in the first place?
He did, arguably in the first year, he's like, oh, you're going to do the ride this year? And I was like, Neil, I don't even have a bike. Like, I can't remember the last time I rode a bike, but I said, I promise next year I'll do it. And I've done it ever since. So I feel, being a part of the Neil Sachse Centre, that I really need to get involved in you would arguably think that I should be getting involved in the research, because it's helping fund the research that I'm conducting. But really, it was an easy choice to make, that I'd do any fundraiser with Neil, as long as I know that it supports him and his sort of vision for spinal cord injury research.
What wisdom did he impart on you?
Neil was very black and white. He didn't and ah about anything. He always had a direction in mind. But the biggest thing, and I've spoken to Neil's wife about this, and we all share the sort of same story, but one of his quote would just be, get on with it. Like, as blunt as anything, just get on with it. Just make it work. If it doesn't work, find something else that will move you forward. And that was very much like, ever since Neil's accident, it was the exact same thing. So he didn't want people to feel sorry for him after his injury. He was just, how do I get back home, look after my kids and grandkids, and then how can we raise funds for spinal cord injury research? And if someone said, no, you can't do it, and he's like, well, why not? He would really push people to, well, you say no, but why? And that sometimes that really gets you to think, actually, yeah, why? And then you sort of push the barriers of whether it's research or just sort of your own personal goals or anything like that. And I think that was really what stuck with me ever since his passing. Like, sometimes you're writing a grant and you're like, I just really don't want to do this anymore. And then Neil's voice in the back of the head just like, come on, get on with it. Just get it done and move on.
So you still hear his voice?
Oh, absolutely. I still hear his wheelchair hitting 60 k's an hour, zoomed around SAHMRI as well. So yeah, there's no speed limits at SAHMRI for Neil. So yeah.
What do you think he would think of how far you've come so far in your career?
Neil often like egged me on, and we had a bit of banter and whatnot, but he was always very, very positive. He probably arguably put me up on a pedestal that I didn't like being on top of. But yeah, I think I would like to hope that Neil is proud of, the work that I've taken on for his vision, but also my vision as well, and that, it's something that he would support and be proud of moving forward as we go along.
What are you most focused on at the moment?
So at the moment we have 2 clinical trials, and my main focus is getting them finished. So we've had a lot of issues with COVID. Anyone who wants to do a clinical trial and research, don't do it during a pandemic. It's not fun. So my goal is to really get these studies finished, because we're getting some interesting results. And the more results we get, the more likely we are to turn that into bigger funds, whether we can increase our trial capacity where we're doing it all over Australia, or get some international sites as well where we can increase the number and really delve into the research that we're doing.
What are those trials looking at?
So they're 2 completely different fields of spinal cord injury research. So the first one is Project Discovery, which is Neil's baby. So this study is looking at different ways we can diagnose patients following spinal cord injury. So to give it a bit of background, normally when someone has a spinal cord injury, they go through what's called an INSCI examination. It's a neurological examination where they're poked and prodded and asked, can you feel this? Can you move this? Look for reflexes and all that kind of stuff. And that puts the patients on a neurological scale that allows clinicians to stratify how they may do surgeries, direct rehabilitation, all that kind of stuff. But it's very archaic. Like, Neil had that examination in the 70s, so not a lot has changed. So we're looking at ways how we can create either alternatives or surrogates to that type of examination. So at SAHMRI, we have a cyclotron which produces radioisotopes. And what we can do is we can take these radioisotopes and attach them to specific markers, which then, when they're injected into the body, go into the spine and light up, if you will. So imagine like a bright light that's emitted from the spinal cord. And we've shown through animal work that you can predict the neurological outcomes of an animal with a spinal cord injury just using that imaging modality. So we've currently got a trial in humans to see if we can do the same thing. And then our second study, it's in the area of imaging, but we're actually imaging sexual function, which sounds a bit strange. But basically, sexual function or dysfunction following spinal cord injury is one of the highest priorities of people with spinal cord injury. So if you ask them the question, what would be your top 3 priorities? First one is move your hands for a quadruped. Any sort of motor improvements, so maybe being able to stand or wiggle your toes or anything like that. But the third is being able to have sex or have sexual function, like normal sexual function. And what's quite interesting is it's the most undertreated symptom of spinal cord injury or comorbidity of spinal cord injury. And the reason being is that we don't actually know how sexual function works. Everyone thinks it may be just the brain, but actually the spine is what's responsible for sexual function. So when the spinal cord becomes injured, it changes that pathway. So what this particular trial is we use MRI, or an advanced MRI technique called functional MRI, where we look at blood flow in the spine, which is a factor of neural activity. So when the spine becomes activated, so if you wiggle your toe, you'll get blood flow into the spine, and the area that's responsible for your toe in the spine will light up, if you will. So we're currently mapping out the regions of sexual function in the brain and the spine and looking at how it changes with spinal cord injury, with the idea of, there may be pathways that we can then target for certain therapies, or, someone may think they don't have sexual function, but we could actually say, well, you do. You just need to learn how to harness it a different way, which would be huge for someone with a spinal cord injury, and it would have huge implications for their quality of life.
Yeah, that's fascinating stuff. And of course, in order to live a healthier life and a life that's of much better quality, that sex is a super important component. So, but I think something that if you weren't in the field, you wouldn't think about instantly. Obviously, you think about people wanting to walk again and wanting to move as they did, but not that necessarily. But that's the benefit of speaking to people who are actually living with this condition.
Yeah, absolutely. Like I've got participants in our studies who are like, oh, if you could just take the pain away, I'd be completely fine. I've accepted that I'm never going to walk again, or, I'm not going to be able to stand up by myself again. But if you could just remove the pain, I'd be all for it. Or, if I could have sex with my partner, like that's huge. And a lot of these things, they have knock-on effect, whether it's mental health or going back to work, like they have huge implications as well, because, it's that sense of identity that we were talking about before with myself. But, some people enjoy going to work, and the fact that they can't go to work because they're in so much pain day in, day out, that, that has huge implications for their quality of life.
Yeah, so people can adapt to living a new way, but they can't do it if they're in horrendous constant pain, or if they can't have any sexual function.
Yeah.
So it's not necessarily about things going back to the way they were before they received that injury, but helping them to be able to adapt to sort of a new normal.
Yeah, exactly right.
What do you love about working at SAHMRI?
When I didn't even know SAHMRI existed when I applied for the job. I didn't, it was a very new building at the time. But then coming to SAHMRI from a university with a very sort of closed lab, if you will, where, you work within your group, and everyone has a key, they're all working on the same thing or similar thing. Coming to SAHMRI just sort of opened my eyes to collaboration, all the different types of research that's out there. But the biggest thing with SAHMRI is just having everything there available. All the pieces of equipment that we have cutting edge equipment that, other places or universities don't have. And you know what? Like, we've got the medical school right next door, and then we've got the hospital on the other side. Like, there's not a lot of institutions anywhere in the world that have the capacity to, or the infrastructure that allows to have all those resources at hand. And I think SAHMRI, it's an incredible institute, and I'm very, very lucky to work there. And I just, the culture of SAHMRI is, it's awesome. The open lab spaces, the open office spaces, which invites collaboration, almost forces it in a way, I think is really, really good for the culture of research, which, it is a tough gig. SAHMRI really sort of assists in allowing for it to be less tough.
What about outside of work? How do you switch off? Do you switch off?
If my students are listening, yeah, all the time, of course. I could just pens down and, no, I think I'm always sort of, it's probably one of my flaws where I can't quite just switch off and maybe get too fixated on certain things, which can then distract me from other things. But for me, it's golf. That's really, just golf. So watching golf videos or playing golf, that's my sort of switch, if you will.
There's plenty of men around the world that relate to you on that
Absolutely,
one.
Yeah.
Do you think there will come a time where we're able to restore people to how they were before or after suffering one of these injuries?
I get asked this question quite a bit, but it's really, really tough. I think there's sort of two sides to the story. There's obviously the biological side of it, but then there's also the, I don't know how we put it, it's like the political side of things maybe. So I think from a biology standpoint, there's still a lot that we don't understand, and I think that's one of the limiting factors of really breaking through to, treating someone so that they're back to the way they were before their injury. I think realistically, I don't think, from an evolutionary standpoint, the spinal cord or the brain is not meant to get injured, So as we've evolved, maybe our defensive mechanisms or our biological mechanisms have gotten better, but it's such a, rare accident that we just don't have the biological capacity to go back to the way that we were, at least as humans. But I think one of the barriers there is of this lack of understanding or limited understanding of the nervous system is the funding of research that involves, spinal cord injury. Spinal cord injury research is poorly funded everywhere. It's not just Australia, but all over the world. I've just come back from a conference and you've got clinicians just saying, I can't get any money I've got this great idea, I've got this drug that I know that works, but no one will give me money to trial it. So until we overcome that barrier, it's really going to limit the amount of research that amazing scientists can do that will eventually find the cure or get those individuals back to almost normal again.
So you're confident there's a lot more improvement to come, but only if we can spend the money on it?
Yeah, absolutely. There's some incredible, in any field of research, there's all these pioneers of research, but they're limited, by the four walls of the money that comes in. That's it, really. So until the government sort of comes to the table and goes, all right, we need to stop dumping money into submarines and maybe dump some money into research, that will be the limiting factor.
I hope that day comes.
Me too.
Thanks, Ryan.
Thank you.
If you want to learn more about SAHMRI and the researchers working to build a brighter, healthier future for you and your family, head to samhri.org.au.